What advancements improved Seminoma testicular cancer treatment? Imagine a cancer that used to be almost untreatable, now with survival rates soaring above 90%. That's the story of Seminoma, a type of testicular cancer, thanks to many medical advancements over the years. Let's explore how these improvements have transformed treatment and outcomes. The foundation of treating seminoma remains surgical removal of the affected testicle, called a radical inguinal orchiectomy. This procedure is highly effective for early-stage disease. For some cases, especially for stage 1 and low-volume stage 2, doctors have explored removing nearby lymph nodes in the abdomen through a surgery called retroperitoneal lymph node dissection. While not yet standard for seminoma, this approach has shown promising results in certain situations. Chemotherapy has been a game-changer since the 1970s. The introduction of cisplatin-based regimens, such as the combination of bleomycin, etoposide, and cisplatin, dramatically increased cure rates for advanced and metastatic testicular cancer. For early-stage seminoma, a single dose of carboplatin chemotherapy is sometimes used to lower the chance of recurrence, offering a less toxic alternative to more aggressive treatments. Radiotherapy was once a primary treatment for seminoma, especially for stage 2 disease. However, due to concerns about long-term side effects like secondary cancers and heart problems, its use has decreased. Today, radiotherapy is reserved for specific cases where chemotherapy or surgery might not be suitable. Active surveillance has become a standard approach for stage 1 seminoma. After surgery, instead of immediate additional treatment, patients are closely monitored with regular scans and blood tests. This method helps avoid unnecessary side effects and overtreatment, catching any recurrence early when it is most treatable. Advances in imaging, especially CORT and PET scans, have improved how doctors stage the cancer and detect metastases. PET scans are particularly useful for evaluating residual masses after chemotherapy, helping distinguish between scar tissue and active cancer. In addition, newer biomarkers are emerging. Traditional markers like alpha-fetoprotein and beta-human chorionic gonadotropin are helpful, but recent research has identified microRNA markers such as miR371, a 3P. These show potential for higher sensitivity in detecting active disease and predicting relapse, although they are not yet part of routine care. Long-term care for survivors has also improved. Because cure rates are high, doctors now focus on managing late effects like cardiovascular issues, secondary cancers, hormonal problems, and emotional health. Efforts to reduce treatment intensity aim to maintain high cure rates while minimizing side effects. Every treatment plan is personalized based on the cancer stage, patient preferences, and risk factors. Surgery is typically the first step, followed by options like surveillance, chemotherapy, or in some cases, radiotherapy or lymph node surgery. Ongoing research continues to refine these strategies, balancing the goal of curing the cancer with preserving quality of life. While this discussion centers on seminoma, many principles, such as early detection, multidisciplinary care, and survivorship planning, are relevant across reproductive cancers like cervical cancer. Still, the specific treatments and biomarkers differ by cancer type. Always consult healthcare professionals for personalized advice. Thanks to these advancements, seminoma has become one of the most curable cancers, with survival rates exceeding 90%. Ongoing research aims to further improve treatments, reduce side effects, and support survivors in living healthy, fulfilling lives.